What is the aim of this rapid test? I have told already the rapid test is not a confirmative test, then why it is done? And I told it is to find out the target people for whom confirmative test is to be done, because I told for various reasons confirmative test cannot be done for all people. So I would like to segregate or isolate people who may require who requires a confirmative test. That is why it is called rapid test is a screening test. So rapid test, as I told you, cannot see the organism. The rapid test will show the presence of the antibody against that particular organism. Here, rapid test will show the antibody produced by the immune system, and we know this antibody is very specific to that particular virus. That means what? If the antibody is there in the blood, that means the organism has entered into your body. That is why you see this antibody. So that means rapid test will see only the response of the body in the form of antibodies. So rapid test cannot see the antigen. Rapid test cannot show the organism. Right. Now we know an antibody, we know the antigen, we know something about the rapid test, the confirmatory test. We have two tests. One is a screening test which raises the doubt. The other is a confirmatory test which actually shows the organism. The next question is, during this course of the disease, starting from the entry of the organism, ending the convalescence period, incubation period, period of illness, convalescence, these three phases. During three phases, the timing of doing this test, one. Second, will these two tests can be done during the whole course of a disease? Will they be positive or negative? This is the next question. When should I do if I really want to see the organism? Will this confirmatory test will show, will it be positive on the day of entry of the organism into my body? First doubt. Next doubt. If it does not show on the day of entry, then when can I see the confirmatory test, or when can I do the confirmatory test? How long should I wait to do a confirmatory test? One. Second, I told antibodies are the response of the immune system of our body. How much time will it take for the immune system to produce these antibodies? Because only if the immune system has started producing the antibodies, then only the rapid test will be positive. That means what? These two tests will not be positive or negative during the whole course of a disease. At certain time, the PCR will be positive. At certain time, the rapid test will be positive. So first you have to decide when this test should be done. That depends upon, as we know, two factors. Presence of organism, confirmatory test will be positive. Presence of antibodies, rapid test will be positive. Presence of organism plus presence of antibody, both the tests will be positive. I think you know the concept now. In this slide you see on the left hand side, unexposed, that is the person is not exposed but he is susceptible. That means he is living in a crowd, and anytime the organism may enter into his body because he has a history of contact, but still the disease is not acquired. So this is a stage. Here The organism has entered. Forget about the shaded area. Concentrate on the first incubation period time. Here the person is exposed. The organism has entered. We know the incubation period is entry of the organism. During this incubation, the organism tries to multiply in number. So at this time, what really happens? The organisms are present, but the antibodies are not present. That means the organism is inside the body, but there is no antibody. Question is, why there is no antibody when the organism is here? The answer is, the organism is a new organism to the immune system. I told you, first time it has entered. So measures, as I told, this antigen. It gets the details of the organism so that it can manufacture or produce antibodies which will really fit to this antigen so that it will destroy. So that means organism is inside, but the antibodies are not here because it will take some time for the immune system to produce antibodies. So during this period, the organism starts multiplying. Now the question is, organism is there, antibody is not there. So the logic is, now I should see the organism. That means the confirmatory test should be positive. Next logic is, there is no antibody. The rapid test only sees the antibody. So the antibody test or the rapid test should be negative. But the irony is, even though the organism is inside, the confirmatory test will be negative here because the number of viruses is very minimal. So it is very difficult to see the organism. But remember, the organism is there. So here, no antibody, rapid test will be negative. Even though organism is present, the load of organism, the viral load we call, is very less. The number of organisms is very less. So naturally, confirmative test also will be negative here in this scenario. One more point here is, because the body starts producing immune antibodies during this period, even though the organism has entered into his body, he will not show the symptoms of a disease. So organism is there, rapid test is negative, confirmatory test may not be positive, but one thing is very sure is very dangerous period here because he is a patient because organisms there. That means he will spread to others, but the person will not know that he is having the organism. The people will not know that he is carrying the organism. So he is going to spread without knowing that he is having the problem. That is the importance of this period. Asymptomatic carrier. He is carrying the organism. Symptoms are not there, so asymptomatic. Tests are negative, so I cannot do this. So all are unfavorable for everyone. So he may spread the disease to others.